Well, good afternoon, everyone, and thank you for joining us today. I'm Dave Epstein, a correspondent and meteorologist for the Boston Globe and WGBH. Welcome to our conversation about ticks and strategies for preventing disease. I'll be moderating today's discussion, and I'm pleased to be joined by three wonderful folks. Gaurab, Basu, Associate Professor in the Department of Environmental Health at the Harvard T.H. Chan School of Public Health, and Assistant Professor of Global Health and School of Medicine at Harvard Medical School. I'm also joined by Richard Pollack, Senior Environmental Public Health Officer at Harvard University, and Cassandra Pierre, Assistant Professor of Chobanian at Avedisian School of Medicine and Medical Director of Public Health Programs and the Associate Hospital Epidemiologist at Boston Medical Center. Our expert panel will explore ways to prevent tick-related diseases and protect yourself from ticks. But first, I think it's important we give a brief overview of the different types of ticks. Richard, you actually study ticks. Can you explain the different types of ticks and diseases they carry, especially here in Massachusetts?
Yes, Dave, thank you very much for the chance to be here. First, why don't we discuss what are ticks in the first place? Many people don't really appreciate that. Ticks are small arthropods. Those are creatures such as insects, lobsters, and spiders that have exoskeletons and jointed legs. Okay, ticks, though, feed solely on blood. That's the only thing that they ever will feed upon. Each kind of tick has its own geographic range, season of activity, preference as to what it may feed upon, and health significance. In New England, we have a lot of different ticks, but people tend to encounter just a few of these. These include the deer or the black-legged tick, the dog tick, and the Lone Star tick. So let me just quickly run through each of these to set the stage for what follows. For the deer tick, all stages, so the larva or newborn tick, the nymph or teenager, and the adult tick can all feed upon people. The larvae are absolutely tiny. They can fit within the zero in the date of a penny, and they're mainly active in the late summer. Nymphs are somewhat larger than larvae, and they're mainly active from late spring into early summer. And then there are the adults. These are considerably larger. They're about a quarter of the size of Abraham Lincoln's head on the penny, and they're most active in the fall and then again in the springtime. Deer ticks transmit the bacterium that causes Lyme disease, but they also can transmit several other kinds of disease-causing bacteria, such as those that cause something that's known as ehrlichiosis and anaplasmosis. Protozoa, such as babesia, that's a distant cousin to the malaria agent, and yet various viruses. Okay, then we have the dog tick, and fortunately, only the adult stage of these ticks will feed on a person. These are active from spring through fall. The dog tick is mainly a nuisance, but they occasionally, but only rarely, transmit the microbe that causes Rocky Mountain spotted fever. And then to round out these big three local ticks of concern, there's something we call the Lone Star tick. All stages of this tick will feed on people. Larvae are active in mid-late summer, nymphs during the spring and midsummer, and the adults during the warmer months. Bites from these ticks tend to be more irritating than those of other ticks, but these ticks can also transmit other kinds of microbes. And then most oddly and interestingly, perhaps the bites of this particular tick can also result in an odd syndrome called alpha-gal that causes some people to develop an allergic sensitivity to meat. All right, so that sort of lays the facts out. And before I turn this over, we have two maps to show very quickly. Maybe we can bring up a tick-borne disease map on the screen for the viewers. And this sort of highlights the geographic ranges of various tick-borne diseases. So it's not that they're spread all across the country equally. There are hotspots and some areas where some of these diseases are almost unknown. And but the ranges of these ticks and the ranges of the diseases that they're involved with transmitting are changing. And we will be discussing some of the reasons why that range may change. So why don't I stop there?
Thanks, Richard. So, Gaurab, we know that the climate is obviously changing and warming up, and we're seeing ticks become more active during the typical season, but also in the atypical season. I know, I've got a dog over there somewhere, and I pulled ticks off in January. What's going on with the fact that, you can go out on a winter day and get ticks now?
Thanks, Dave. I think I'll start my comments by just kind of anchoring on the point that we're talking about two pretty complex systems. One's the climate system, and there's so many different mechanisms, so many things happening at once when we put anthropogenic human-made emissions and changing our atmosphere. And number two, I think, and I think Dr. Pierre might agree with me, that infectious diseases is one of the most complex parts of medicine. And I say that because for infectious diseases, you have the environment, you have a vector. In this case, we're talking about ticks. You've got the bacteria or virus that is being spread, and then you have the human being. And so there's so many things weaving between all of those elements. And so the message here, there's complexity. We can't say any one case of Lyme is because of climate change. That's not the way we think about it. But we have to understand what we're doing to our environment, what we're doing by burning fossil fuels and warming our planet, and the trend lines that we are creating because of it. And so let me just maybe say a few things about where we are on climate change, and I'll speak to your comment more specifically. We are at unprecedented levels of burning fossil fuels and anthropogenic emissions. We still have not peaked and gone downwards. And recently, there was a really good New York Times article this past week of some concern that even the warm isn't accelerating. And there's a variety of hypotheses for that. It's not exactly clear yet, but there's real concern that we are entering, a more dangerous phase of climate change, which I think most people are recognizing. And that could be because of decrease of aerosols. There's some concerns about changing in cloud activity. So I'll just start with the message that we got to stop burning fossil fuels, and we've got all the solutions we need to have a clean energy economy. So that being said, why are you pulling a tick off your dog in January? Well, first of all, with the warming planet and with warming seasons, the seasons in which these ticks can thrive are longer. So that's just one piece, is that they're around longer. And with more mild winters, they're able to kind of stay active and cause us issues even through these more mild winter times. And there's a distribution issue here. As temperatures warm, as the distribution of our weather patterns change, the ticks are moving, and that causes them to show up in places that were not there previously. Also, there's issues of the ways in which temperatures are changing things like mouse populations and other species in which these ticks are interfacing with other species to ultimately get over to human beings. And maybe one other thing I'll say is, we think about climate change and a warming planet and the way it's changing vector-borne illness. Today, we're talking about ticks. We certainly think about that with mosquito-borne illness as well. But one piece I'll also just mention here is that, the idea of planetary health and our ecology is really important as well. So one of the first things that comes to my mind is that we are moving into spaces that were natural spaces, right? We're kind of cutting down into nature and having homes there and having communities built in places that were previously untouched by human beings. And so we get in closer proximity to ticks and put us in more vulnerability to get these kind of diseases.
Thank you very much. All right, so we've got the different types of ticks. We've got the reason they're more active. Now let's talk a little bit about what they do. Cassandra, many people have heard of Lyme disease, of course. It's been around for several decades at this point. Some of the other diseases are equally, if not more concerning. Could you talk to that a little bit?
Sure. Again, thank you for having this conversation and the opportunity to talk about these issues. I would say that, Lyme certainly does still dwarf everything else we see. That it remains the most common tick-borne infection that we see in New England, as it does in the United States. But as Richard mentioned, we do see others in this area, bacteria such as anaplasma or the bacteria that cause anaplasma, plasmosis and ehrlichiosis, and the protozoa parasite that causes babesiosis. These have a spectrum of severity from mild to, in some cases, for some hosts, causing a little bit more severity, needing to go to the hospital. Lyme disease, for example, usually quite mild and treatable, but if left untreated, potentially can develop complications like arthritis, cardiac issues, neurologic manifestations can be seen. In addition to those more common tick-borne illnesses in our area, we do see some rarer ones, including tularemia or Powassan virus, which remains rare, but like other infections, we're seeing some increases in the number of cases we see in our area. For Powassan virus, we do know that even though most cases are mild, in certain hosts, older hosts, we do see more severe neurologic disease. We can see encephalitis, we can see seizure activity. And so there, again, what we're seeing is a range, even within one disease. And there's a complex interplay between the host, ability to get treatment, which we have for Lyme, babesiosis, anaplasmosis, and ehrlichiosis. And so there are some, there's not a one-size-fits-all model, but I will say that although we generally feel like we have a good sense of how to evaluate and treat these diseases, one thing I'm seeing more commonly is co-infection. So whether it's one single tick bite or sequential tick bites, we see people who have more than one tick-borne illness. So Lyme and anaplasma, or Lyme and ehrlichiosis, or Lyme, babesiosis, and anaplasmosis. And so the issue with that is that those patients can present with disease with symptoms that are consistent with Lyme, which is top of what many clinicians are thinking about. And they may get treated for Lyme, and it can be there can be a delayed recognition that there are other infections that need to be treated with other kinds of antibiotics. So with those co-infections, we do see more severe disease and delayed treatment, as well as a prolonged tail of symptoms as well. So that's one of the things that cause some concern. And I just want to mention also that even though we don't see as much Rocky Mountain spotted fever, as Richard alluded to, it's uncommon in Massachusetts. We do see it. It can be seen in Massachusetts, including and especially in the southern part of Massachusetts, the Cape and Martha's Vineyard. And the important thing about Rocky Mountain spotted fever is that the bacteria that causes it can be treated with antibiotics, but it has to have prompt recognition. It can lead to a life-threatening disease.
Thank you so much. I mean, obviously the seriousness of getting bit by a tick, you definitely illustrate. As someone that walks in the woods and gardens and does this a lot, I find them on me, and I do, I check myself regularly, and I pull them off, but sometimes they've actually bitten me. What would you advise to somebody that, didn't have one at 8 a.m. in the morning, finds one at 9, pulls it off at 9 o'clock, it was on them for 5-10 minutes? Talk a little bit about, what someone should do in that sense versus it's been on me for 2 days.
Yeah, it's a great question. Also, kudos for you for removing them. I think that is the most important thing to do, removing the tick as quickly as you can. And I am gonna, I don't know if we have time, but maybe Rich later could talk about the method because that is important. The method of removal is important. However, I would say that we do see when ticks attach, they need to attach for a period of 24 to 36 hours, really to see the opportunity to expose the host that they're attached to, in this case humans, to their saliva and any attendant infection and pathogens that are included in that saliva. So for someone who had no ticks attached in the morning and found a tick in the afternoon, I would say removal would be sufficient. You've done what you should do. There, of course, are people who may not see the ticks that are attached. And so there are other things that can be done, like showering to make sure that any other ticks that are unseen are dislodged. But watching and waiting to make sure that no symptoms develop, no rash develops, that's important as well. However, for people who, there's no blanket recommendation, But in areas where Lyme disease is endemic, like New England, where we have the ticks that cause Lyme disease, if you see a tick that is consistent with a deer tick, and it has been greater than 24 to 36 hours likely that, that it could have been engorged based on the time that you found it, and the time that you had an exposure, you were walking in the woods or gardening. It's been within 72 hours from the time that you've taken it out. That's important too, because once that period is over, the incubation period has started. So with those things in mind, if you're in an area where Lyme is endemic, you remove or see an attached deer tick. It's been 24 to 36 hours. You may be eligible to get prophylaxis. There is prophylaxis there with doxycycline. 1 dose of doxycycline can be used to reduce the risk of Lyme disease. It's been shown to reduce the risk by as much as 87%, in fact. So there is that option, but it's not a one size fits all model. This is specifically for Lyme disease. We don't have any information about other kinds of post-exposure prophylaxis that would be helpful for other kinds of tick-borne diseases at this stage.
Let's talk a little bit about the cycle outside with ticks. So here we are, first day of July. And Richard, I'm gonna throw this over to you. Can you talk a little bit about the activity of ticks over the course of a year? Because I notice, April and May, really the dog gets a lot of them. And it seems to me anyway, and talk about this a little bit, seems to wane a little bit in the heat of the summer and then maybe pick up a little toward fall.
Sure, Dave. As I already mentioned, that each tick and each stage of each kind of tick has a distinct seasonality. And that's an interesting thing to discuss here. And I apologize if there's a dog barking in the background. I can't control that. So, yeah, as climate changes, as temperature and humidity patterns change, as vegetation patterns change, we expect also the range and the seasonality of the ticks to change a little bit. But even on a more narrow scale, within a particular day, many of the ticks they're very sensitive to humidity. And when the sun comes out in the morning and starts drying out the vegetation, the ticks lose water and they become less able to hold their position waiting for a host on vegetation. So they will let go and drop down to the leaf litter where they're going to be much less active until they can rehydrate, absorbing moisture from the air. Peak times of risk or of the chance of encountering some kinds of ticks would be in those first few hours of the morning and then again in the evening. But really, any time of day, there's some amount of risk associated with that.
Can you talk a little bit about ways in which sort of the average person who might be spending time just walking in the woods can protect themselves against getting a tick with, and I think we're all mindful of, adding chemicals to our body as well. So talk a little bit about that.
Yeah, that's great. And first, let's address the fear that many people have. They hear about Lyme disease and the other tick associated infections, and they jump to the conclusion, I think the wrong one, that they should stay indoors. No, go outside, enjoy nature. It's healthy for you, but just have a healthy respect that nature sometimes bites back. When you or your family go out in an area, just realize that there are ticks out there. So how can you reduce your risk to some extent? Well, if you're walking through the woods and if there are paths you can walk on, stay on those paths. Avoid brushing up against tall grass, brushy vegetation. That will reduce the chances of that tick encounter. Now, you might do what I do and what I recommend, and that's to wear light colored trousers and socks. That way, if you look down occasionally, if a tick is crawling up on your trousers, you can see it and just flick it off. That's easy to do and send the tick for a ride. Another thing you can do is to pre-treat your clothing with a EPA registered formulation of what's called permethrin. That's a synthetic version of what you can extract from chrysanthemum flowers. So permethrin is actually pretty darn safe unless you're a tick or an insect. You can pre-treat your clothing, let it dry, and then any tick that walks on that treated fabric, even just a couple inches, is likely to become highly irritated and drop off and may even die. You're not going to die from that, but the tick may, and that's the important thing. You can also apply EPA registered insect repellents to your exposed skin and to your clothing. That's perfectly fine. And then I guess most importantly, even if you do all of those things, you might still encounter a tick. Check yourself occasionally while outdoors, and then definitely once you come inside. If you find the tick on yourself, remove it promptly. The whole tick does not embed into your skin and disappear into your body. It's only the tiny, tiny little mouth parts that enter a fraction of a millimeter. And so grasp them. If you have fine tip forceps, well, like this, that's the best tool. If not, use your fingernail, a credit card, whatever. Yank the tick off. Speed is far more important than is the actual means of removing. And the reason there is, and as Cassandra mentioned, the longer a tick is attached, the more likely it is that it will be able to transmit one of those nasty pathogens to you. So remove it. And then maybe it's a good idea, save the tick. Use a piece of tape, tape it down, put your initials next to it so you know who it belonged to, or your child's name or whatever. And then if you or your doctor decide to uh, explore what kind of tick it was and whether the tick was infected, how long the tick was attached, all of those are resources that you might be able to find. Talk to your doctor as to what the next steps should be.
Thank you. Thank you. Gaurab, let's talk a little bit about messaging. I know, in my world as a meteorologist, it can be challenging sometimes to convey what's really going on with the weather, and people misinterpret things. So, what are you finding with messaging around this subject, and what recommendations do you have around it as well?
Yeah, it's vigilance but not panic. I think it starts with the fact that a lot of the symptoms you get from tick-borne illness, muscle aches, fevers, joint pain, they're non-specific. So people could have a cold, they could have, a mild viral syndrome, and they get worried, do I have a serious tick-borne illness? This is, I'll just emphasize, this is the value of medicine, this is the value of public health, is that there's a lot of nuance in the way that we navigate this. Like Cassandra had said, if you have a tick taken off quickly, you're not at concern. So I think it just highlights that, if you have some concern, talk to I'm a primary care doctor, talk to your primary care provider. But I just want to maybe say that there is a lot of nuance, there is a lot of complexity. I think, physicians and healthcare providers take this seriously. They understand the context in which some of these symptoms manifest. But I'll in clinic often I'll have people who want testing just right off the bat, and they're very worried and they're thinking about the kind of worst case scenarios. And there's a lot of scenarios in which a Western blot test is not appropriate, where the antibodies, you're not going to catch them. They're not going to, the blood test won't give you the information that you need. And so our job is to collect good information, to do good testing when appropriate, and know when to worry and not. So I would emphasize it's really important for your health to be outdoors and to enjoy the outdoors. There's particular things that if they happen, then you should get checked out right away. The erythema migrans rash, the classic bullseye rash, is important. If you have that, then you should call your provider and get checked out right away. The good news is that doxycycline and amoxicillin also are really good treatments for this. So we know what to do. I'll mention this rash only happens, I think, around 80% of the time or so. So you could have it without it. But if you're having unusual symptoms, like, especially joint pain, high fevers, things like that. It's just important to have a nuanced conversation with your provider. But I would say that, again, I want to kind of speak to both pieces of this, is that because of these environmental changes, because of a lot of factors, there's much more tick-borne illness here. That's why we're having this conversation today in this area of the world and country especially. It's something we have to take seriously, and its incidence is much higher. I also see a lot of kind of real concern and kind of wanting testing when it's not appropriate. And again, it's our job to kind of navigate that with our patients.
Thank you.
I
So
wonder,
we're going to take a couple of viewer questions here. This next question actually comes from Mira, who works for Alameda County Healthcare Services in California. And I'm sure this is a question on top of many people's minds. Richard, you mentioned you have a dog. I have one sitting on the couch behind me as well. What can we do to protect, especially dogs? Because dogs are walking with us. They're outside. And I'll just say personally, I use the look every single time method and pull them off because I'm frankly nervous about the medicines that go on the dog. So I'd love you to address some of that.
Okay, it's a great question. It's actually fairly simple. My advice would be to ask your veterinarian to guide you. And more likely than not, they're going to suggest or prescribe what they think is an appropriate treatment for your pet. So the options might include, there's some oral medications your dog can take. There are top spot treatments, little drops you put on the back of the neck once a month or so. There are medicated collars, and yet many more things. The important thing to know here is that whereas some of these medications are highly appropriate for dogs, some of them are not suitable for cats. So make sure you talk at some detail with your vet to know how and how not to use these things. And then, as you do, Dave, and as I do when I bring my dog in from the outdoors, check your pet carefully for ticks and remove any of them promptly.
Thank you. All right, Cassandra, let's talk a little bit about this, sort of related to the dog question, because my dog a couple of days ago had the vaccine. So I take him to the vet, he gets the vaccine. Okay, and I'm always like, my dog can get a vaccine. Why can't we? What's going on there?
yeah, no, I know it's confusing. I also want to cheat a little bit and just reference back to something that Gaurab had mentioned, which does affect you and your dog as well. Understanding that we absolutely do need diagnostic stewardship, and there's no reason for panic or being overly concerned. One thing I have noted as well, however, is that we, in addition to some of the ranges for the ticks expanding laterally, we also know they're expanding, or at least their range is expanding in the community into places where we don't always think of an exposure risk. So we think of wooded areas, for example, hiking, gardening. We have had people who've had exposures in the public park. And so there may be ticks in areas that are thought of as more urban potentially than woods. So it's not a reason to not go to the park, enjoy those spaces as well. I certainly do. But just a note that there may be a wider scope of places just to do some checks and think about where you are, and again, stay away from brush and on paths. But as far as vaccines are concerned, yes, it is very true that there have been canine vaccines for Lyme disease since the 1990s, I believe. There actually was a human vaccine that was FDA approved in 1998, Limeric's name, and it was in clinical trials shown to be 78% effective in reducing the risk of Lyme disease, but it was pulled from the market in 2002 for a variety of concerns. One of the interesting ones, though, probably the bigger ones, is that the popularity was low. At that point, we had less cases of Lyme. We had more limited regionality. And there was also a sense of, we can treat this with medications. And so do we really need the vaccine? And so as we've had more cases and a spread, it's interesting that there's been a lot more energy put into the space. And so there are actually a number of vaccines and preventive agents that are being evaluated at this moment. So I think this is kind of a watch this space moment. The one that's furthest along is a vaccine that is targeting the most common bacteria that causes Lyme disease, Borrelia burgdorferi, and it is in phase 3 trials at this moment, and they have been enrolling people in this area and other high-risk areas, not just looking at region, but looking at the kinds of people, the kinds of activities people do. So targeting people who are more likely to be out in the woods and have tick exposure. So the hope is that we'll get more information about this in a year or so. There's a lot of interest around this particular candidate. And there are other interesting other strategies that I think are really interesting. I won't go through all of them, but one that I found really interesting was a vaccine candidate that's earlier in development that is looking to immunize against tick saliva, with the thought that if you have a tick, if you've had this vaccine, a tick begins to feed, potentially you could have an inflammatory process that reduces the ability for the tick to feed, which would then be a broader solution, reducing exposure and infection for tick-borne illnesses that is not pathogen specific. And so that's interesting. I think there's so much more work to be done there, but there has been a vaccine that was created in the past, and there are newer agents potentially with better efficacy, more applicability, less side effects that we might be seeing coming out in the near future. So it's good to look at.
Thank you. So let's talk a little bit about, I know we have folks watching obviously from New England, but we have folks that might be watching this from any part of the country or the world for that matter. I'll open this up to either of you or any of the three of you. Talk a little bit about the risks across the country. Are there spots, where are different types of ticks? Can I avoid this if I'm in the West Coast, if I'm out in Seattle or something like that? Where in the country is the highest risk for just tick-borne illnesses in general?
Well, I guess I'll jump in on this. All tick-borne disease is local. So here in New England, we have that long list that I mentioned and Cassandra also built upon. But you can jump over to California and encounter Lyme disease there as well. They have a very close cousin to our deer tick or black-legged tick. There's a western variety of the tick, and it's involved with transmitting the agent of Lyme disease as well. But there are many other places around the country where you'll run into yet other kinds of ticks with their own associated infections. So I would warn people, or discourage people rather, not to plan their vacations or their business trips on the basis of where they're going to encounter ticks or tick-borne disease, because then you'd never go outside. Just be aware of these things. Once you return, if you are feeling unwell, tell your doctor and also reveal your travel history. That is so important. Many physicians don't necessarily ask, where have you been for the last several weeks or months? But this is sometimes absolutely critical information. Opens up all sorts of possibilities. So whether you've gone to Denver or wherever, mention that.
I would
Wondering,
that.
so one thing I wonder, I don't like mosquitoes, but then I'm like, well, the bats eat them. Are these things, are ticks, like, is there something that they're doing that's good? Is there yes, they're affecting humans, but what are they for?
That's a good question. Well, you can ask what are human beings good for, but let's not go there. That's a whole nother discussion. There are a lot of things that eat ticks. There are very few things that are specific in targeting ticks. There are a couple of parasitic creatures that you'll never see, but the ticks probably worry about them to some extent. But ants, some birds will eat ticks. Small rodents are constantly grooming themselves, so they'll pick off the ticks from themselves and from their nest mates and eat those ticks as well. So a little bit of nutrition associated with it, but I don't think any animal is going to get fat on them. In a evolutionary standpoint, one could discuss, how ticks and tick-borne diseases have affected the health of humans and large animal populations in particular. But that's the topic of another hour-long discussion.
Gaurab or Cassandra, this might be for either of you. Are there, we hear a lot about citizen science programs now, looking out and reporting information in to scientists to help them. Are there ways in which the public partnership with the public that you want to make folks aware of who might be on this, like that can help scientists?
I personally don't have a formal recommendation, but I do think that, being observant to what's going on around you, noting, if there's an area where, for example, you've encountered or seen a tick that is not currently in our, common sense of like, this is an area where you would expect to see a tick. That's important. I think Richard mentioned, potentially keeping the tick that attached to you in, keeping that so that you can show to a doctor or an expert for identification. I think having some observation around those issues is helpful to feedback, to know if there are changes in patterns. I think I don't have a formal recommendation, but I think it's helpful to know what's happening and what you're seeing, and if it deviates from what you've seen for seasons in the past, because you might be on the leading edge of seeing something that has not previously been reported.
I think the most effective interface between science and the public is to really have these signs out, in these areas of, in public parks and places that people are going, hiking and the rest. I mean, you're seeing the kind of the recommendations we're giving are really the basic kind, to be vigilant, to cover up. So it doesn't take much, but you got to think about it. Really, I think, Dave, you talked about this at the beginning, is kind of knowing what's on your body at the beginning of the day and after you've come back from something is I think one of the most important things. Does everyone want to kind of scan themselves every day and check it out? If there's certain areas you live in, if you live in rural areas, if you're out, in areas where it could be more of a concern, everyone's busy and they want to just go about their day. It takes, very little time, but these small investments, I think, are worth it now, given the kind of prevalence that has increased.
Thank you. All right, so I know what my weather models and my climate models say about what things are going to look like in 2036, 2056, et cetera. Are there models that look at where tick-borne illness is going? What can we expect to be happening over the next decade or two with things like tick-borne illnesses and ticks themselves?
I'll jump on this one, Dave. Good question. There are lots of models, but at this point, of course, they're just that. They're models. We'll have to wait and see the extent to which they might predict reality. Whether we're talking about what ticks or mosquitoes are going to be like later this season, so more of a weather pattern arrangement, or if we're looking long term at the climatic range changes, we'd be basing those predictions on weather or climatic predictions, and that gets it's very difficult to do with assurance. So they're great exercises, but we basically have to wait and see.
So we've got just a couple of minutes left. I'd like to give each of you an opportunity to sort of say the thing that maybe you think, oh, I wish I had said. So is there something that you have not had an opportunity to talk about that you would like to convey? And Cassandra, we'll start with you. Is there anything you'd like to leave us with this afternoon?
Sure. Definitely don't want people to think tick bites inevitably lead to disease. I think we've said a little bit about that. Not every tick has an infection, even here in the Northeast, let alone other places, and not every bite from an infected tick is going to transmit infection either. So important to know that, we've already talked about the things that you can do to prevent a tick bite, and how you can recognize ticks and remove them as expediently as possible. But even in that setting, just important to know that, even if you have seen tick that's engorged, that's been there for God knows how long, attached to you, it is not inevitable that you will become infected or get sick. Certainly looking at watching your symptoms, observing the site where you had a bite to make sure no rash is developing there is important. But as a clinician, and I think Richard alluded to this, just people are very concerned about the possibility of getting bitten. This is not a universal phenomena. Certainly, there's more risk that we're talking about in this period of time, but it is not inevitable. So it's just something for people to be aware of.
Thank you. Gaurab, final thoughts.
Look, I think my message would be that nature is a core factor in human health and public health, and you got to respect nature. And I think we often don't. And whether that's our burning of fossil fuels, the way that we're building our communities, where we're moving into, we may want to make ourselves think that it's not going to have implications for health. But I think climate change, I think planetary health are the biggest kind of public health issue of our time. And so we need to integrate, this understanding of how we build our communities, what kind of energy we use, where our roads are, where we're building into, all have profound implications for public health. And so policy matters, making sure that we see the connections between each of these and health, because we don't want to keep operating downstream, make the wrong decisions, and then have larger incidents of disease that we're chasing after. So again, in the public health mantra, we got to go upstream and address these at the core. Thank
you. And Richard, any final thoughts?
Just a few. We've covered with very broad strokes some of the concerns, some of the things that you can do. I would say for any member of the audience here that is interested, there's a lot more that you can delve into to educate yourself on what you can do for personal protection, to protect your family, your pets, how to modify the landscape of your own residential yard. And I guess the last thing is, should you actually encounter a tick? We already discussed this, do pull it off, but a lot of folks worry. And I think I understand why people are concerned, but it's important to pull the tick off, but you don't necessarily need to go to the emergency room to have somebody pull the tick off. You're actually delaying that process. You might be sitting for 6 hours in some cases before you're actually seen. So just pull the tick off, save it, and then you can delve into what it was and what are the risks later. And then just enjoy life, enjoy nature.
I love that last sentiment. Yeah, get outside and enjoy. What a great part of the world we live in, and so many opportunities to be outside. I want to thank Cassandra, Gaurab, Richard. Thank you all for being here for this important, insightful discussion. This conversation will be available on Harvard's PH Chan YouTube channel, so you can check it out at any time and share it with your friends and followers, and they can also learn about ticks as well. Thank you, and have a great afternoon and a great 4th of July holiday.